we're headed. The headline is that cases and hospitalizations are falling since January the 10th, but are still very high. Over the last 7 days, we've seen an average of over 2,200 cases reported each day. That's down from a recent peak of over 6,400 cases reported each day on January the 10th. And remember that for each case that's reported, there are between 2 and 4 others that we haven't detected. Cases are declining in all age groups, and this is a substantial improvement, but these numbers still represent 3 times the number of daily cases compared to our previous pandemic peak in November 2020, and approximately 8 times more than the number of daily cases that were reported in early December 2021 before Omicron struck. The 7-day incidence rate is currently over 700 per 100,000, which corresponds to a very high level of community transmission. Now, although we're seeing an increasing number of less severe infections among vaccinated people, those who are unvaccinated continue to be at the highest risk for COVID-19, for both infection and for the complications of hospitalization and death. In the 30 days through January 27th, people who are not fully vaccinated were twice as likely to have had a COVID-19 infection, 13 times more likely to be hospitalized, and 16 times more likely to die from COVID-19. For example, on January 27th, the risk for hospitalization for unvaccinated people over the past 30 days was 18 per 100,000 per day, while for vaccinated people, it was 1 per 100,000 per day. Likewise, the risk of death for unvaccinated was 2.5 per 100,000 per day versus 0.1 per 100,000 per day for the vaccinated. So our vaccines, especially with the booster dose, are continuing to provide most people with excellent protection from serious infections. Along with vaccination and the booster when eligible, avoiding crowded and poorly ventilated indoor spaces is important right now, along with using high quality and well-fitting face masks or respirators, making sure we have good indoor air quality and ventilation, isolating away from others if you're ill, quarantining away from others if you're not up to date on your vaccinations and exposed to someone with COVID-19, and getting tested when possible if you have symptoms or are exposed. Together, these strategies, these layers, provide the additive level of protection that we need for this time while we have such high levels of COVID-19 continuing to circulate in the community. Now, hospitalizations. Our healthcare system colleagues this week characterized the ongoing strain to the healthcare system as massive. Key stressors are continuing in high patient loads in the face of critical staffing shortages and an increasing backlog of surgical cases and other deferred care. The stress on our healthcare providers is profound. If you know someone who works in one of our hospitals or in healthcare, please show them some love. From mid-December to mid-January, during the Omicron surge, daily hospitalizations in King County increased by 700%. Currently, 50 people are hospitalized with COVID-19 every day in King County. That's someone hospitalized every 20 minutes. Now, the good news is the number's down 20% from our recent peak of 62 people hospitalized per day on January the 12th. But our current level is still 6 times higher than our pre-Omicron baseline and 40% more than our previous pandemic peak number of hospitalizations from December 2020. As of yesterday, there were over 400 hospitalized confirmed COVID-19 patients in King County hospitals. That's down from the recent all-time high on January 19th of 628, but it still represents hundreds more patients than were hospitalized during the peak of earlier COVID waves. About 1 in 6 acute care hospital beds and 1 in 5 ICU beds are now occupied with COVID-19 cases. Now, we all need our hospitals to be able to provide life-saving care for anyone who needs it for any reason. You can help by not going to the ER if you're not having an emergency, and don't go to the ER for COVID-19 testing or for mild symptoms. Get your booster shot. Boosters significantly cut down your risk of being hospitalized or dying. And of course, complete your vaccination series if you haven't done that. Upgrade your mask. If possible, use an N95, a KN95, or a KF94 style mask. Wear the most protective mask you can find and one that fits you well. Avoid crowded and poorly ventilated indoor spaces and maximize airflow and ventilation when inside with others. And don't delay routine healthcare visits. Talk to your primary care provider about your routine medical care to help needing more advanced medical care in the future. And finally, our colleagues at BloodWorks Northwest are telling us that our local blood supply has hit emergency levels. They're asking everyone who's feeling healthy, especially O negative and O positive donors, to please schedule a donation as soon as possible and continue to donate for the next 3 weeks. You can schedule your donation today at schedule.bloodworksnw.org or by calling 800-398-7888. Now, deaths in King County have increased over the past month, but to a much lesser degree than hospitalizations and cases. The daily average number of deaths increased from a 14-day average of 1 to 3 deaths per day in November and December to 9 deaths per day in mid-January. And they've since fallen to approximately 7 deaths per day in late January. There were 89 deaths reported over the past 14 days compared to 106 during the 14 days prior. Our vaccines are doing an amazing job in protecting the most vulnerable in our community from the most severe complications of COVID-19, including hospitalization and death. Now, I want to talk a little bit about the BA.2 variant. Omicron and other variants are made of groups of genetic-related viruses called sublineages. The main sublineage of Omicron, the one that's currently circulating in the US, is called BA.1. You can think of BA.2 as a related sibling or sublineage. It's still Omicron, but it has about 40 mutations that distinguish it from BA.1. BA.2 is spreading rapidly in some areas and has become the predominant variant in some countries, such as India, Denmark, Sweden, the UK, and the Philippines. It's been detected in numerous countries and in more than half of the US states. And so far, BA.2 has been detected in a very small number in Washington State and King County. And we really are a little bit behind in our sequencing, and we'll find out soon what was prevalent in January. We don't really have up-to-the-date information on variant sublineages. Now, the preliminary data for other countries where BA.2 has become common suggest that it spreads even more effectively than BA.1, which is the cause of the current outbreak in the US. And these estimates are over 20 to 30% more transmissible. The good news, though, is that BA.2 does not appear to cause more severe illness, and that our current vaccines, especially with the booster dose, appear to protect well against both BA.1 and BA.2 Omicron viruses, although it's not quite settled whether BA.2 might dodge immunity somewhat better than BA.1. For these reasons, it's not clear what the impact of BA.2 will be on the Omicron surge, whether it will prolong its tail or perhaps lead to a second peak or have no detectable impact at all. To some extent, this will depend on whether people who have been recently infected with BA.1 during our large Omicron surge are well protected against BA.2. Even if so, infections would generally not be expected to be severe. On the other hand, people who are unvaccinated and not recently infected would be at similar or even higher risk for reinfection with BA.2, and for that reason, for hospitalization and death as well. Now, I'm going to shift gears a little bit and address the pandemic versus endemic business. So when people talk about the COVID pandemic ending and COVID becoming endemic, I think what they're really saying is they believe the worst is behind us. And there are good reasons why that may be true. And I hope more than anything that it is. But it's not a certainty. And we shouldn't assume that a variant that's worse than Delta or worse than Omicron won't emerge in the future. The transition from pandemic to endemic will not happen suddenly or by decree, but gradually as we move from a new, emerging, and unfamiliar, highly unpredictable pandemic to an endemic state that is more predictable with respect to the virus's virulence and its occurrence over time. For example, the severity of illness and the degree of year-round versus seasonal disease activity, and the frequency and severity of surges. Both the timeline for this transition and what the endemic state will eventually look like will be influenced by a combination of things, but primarily how frequently and extensively the virus evolves new variants that have greater or lesser virulence, transmissibility, and ability to evade protective immunity in the population from vaccination and/or repeated infections over time, which in turn is related to how well immunity from vaccination and infection hold up against new variants and current strains. Ensuring equitable global vaccine access is also likely an important factor in limiting opportunities for future dangerous variants to emerge. But the term endemic doesn't really help us know what we can expect with respect to severity of illness, frequency of surges, seasonal patterns, or overall impact on the population. What it does do is imply a more predictable range of illness occurrence and impacts. We just don't know with much certainty yet what that state will look like. So from my perspective, the pandemic versus epidemic terminology debate is of little practical value and can even be counterproductive if it leads to complacency by implying that the outbreak is over or by equating endemic with relatively mild or not serious, or to the failure to plan and take the necessary steps that we need to take to help us live with COVID-19 with the least disruption and impact on our health, our economy, and our society over the long term. So the bottom line for me is that today, the long-term course of the pandemic remains unpredictable. What we need to be thinking about and focusing our energy on is how best to protect ourselves and our community right now, given our current reality and given the unpredictability regarding how COVID-19 will evolve. How to adapt and plan for a variety of possible future scenarios using effective and sustainable long-term strategies that are proportional to the range of threat that COVID-19 may pose in the future. These are things like ensuring sustained high levels of vaccination and booster coverage locally and globally, improving indoor air quality and establishing standards for indoor air quality, ensuring the availability of high quality face masks and criteria for when they should be used during future surges, and ensuring increased availability of tests and antiviral treatments, and bolstering our public health, social support, hospital and healthcare system ability to meet and manage future surges and the potential double or triple whammy of COVID-19 on top of seasonal influenza or other respiratory viral outbreaks. So having gotten that off my chest, I'll move along to testing. The demand for testing has declined somewhat in the last few weeks, but test sites throughout the county are still experiencing high volumes. Most sites still require appointments to avoid long wait times. And to help support our healthcare systems, we've reserved testing appointments for healthcare workers at all of our King County operated testing sites, Auburn, Enumclaw, Federal Way, Renton, and Tukwila. Last week, the King County and City of Seattle free testing sites performed over 30,000 tests, and that included the 3 millionth test performed by our county and city and partner testing sites. The average percent positivity is still high at about 25% for tests performed at our county sites, and that's compared to 28% last week, which means that for each reported case, there are several others in the community that are not being tested. Now, we continue to do whatever we can to get more rapid at-home tests out in the community. We're distributing at-home rapid tests purchased by King County at a rate of about 100,000 per week. And we anticipate receiving additional supplies from Washington State. And we are distributing these tests to community-based organizations, libraries, faith-based organizations, shelters, long-term care facilities, and other sites in the community. And I just want to remind everyone that rapid tests are very useful tools, but they're not perfect. It's possible to have a negative rapid test even if you're infected and can spread the virus to others, especially in the first few days of infection. So if you have symptoms or have been exposed to someone with COVID-19 and test negative, you should continue to take precautions and if possible, test again. To find a test site near you and to make an appointment, visit kingcounty.gov/COVID/sites. Now, wearing the best quality and a well-fitting mask is an important way to reduce your risk for being infected, especially in crowded or poorly ventilated indoor settings and when COVID rates are high in the community. Whenever possible, masks like N95, KN95, and KF94 style are preferred. Along with rapid tests, we continue to distribute county-purchased and state-provided masks to our communities that have been disproportionately impacted by COVID-19, including to community groups, food banks, and suburban cities. We also continue to provide personal protective equipment to long-term care, adult family homes, and other high-risk settings that have difficulty securing sufficient supplies on their own. And finally, in mid-January, the Biden administration announced plans to distribute hundreds of millions of free, high-quality masks through pharmacies and community health centers. And these masks are beginning to arrive in King County pharmacies. So please check your local pharmacy regarding their participation and the availability of masks, and please pick some up when they're available to you. Now I'll pivot to speak a bit about vaccination and boosters. As of last week, over 4.5 million COVID vaccination doses have been delivered in King County. Each day, we're seeing more and more residents choosing to be vaccinated against COVID. That's fantastic. If you're not yet fully vaccinated or boosted, we're still here for you. Right now, 87% of eligible King County residents aged 12 and older completed their vaccine series, and nearly 95% have started it. This is outstanding. We're continuing to make progress on youth vaccination rates, but we clearly have more to do. Just over half of our 5 to 11-year-olds have started the series, and over 45% are now fully vaccinated. That's up from 37% 1 month ago. And over 81% of our 12 to 17-year-olds have started their series, and over 3/4 are now fully vaccinated. Fantastic. We know that children and families have lots of questions about vaccination, and we recently worked with UW-Medicine's Dr. Ben Danielson to create a series of videos that answer local kids' questions about the COVID vaccine. And we'll put that link in the chat for you. For those who are fully vaccinated, getting a booster shot is one of the most important things you can do to continue protection, particularly against severe illness, meaning hospitalization and death. We've delivered almost 1 million booster shots and third doses in King County. We know that 85% of our residents 65 and older have been boosted, but the numbers of booster shots have fallen as age goes down, such that only 60% or so of our 50 to 64-year-olds have received their booster at this time, 50% of 35 to 49-year-olds, and 34% of 18 to 34-year-olds. So everyone really needs to understand that to get the full protection from the vaccine, to be most protected against new variants, to avoid hospitalization and death, that booster is really essential. So please get it when you're eligible for it. It's the most important way to stay out of the hospital and also to take some of the burden off of our healthcare system. And the good news is that it's easier than ever to get an appointment for a same-day vaccination or a booster. We've extended the dates of operation at the FEMA Vaccination Clinic in Auburn through February 12th, and are continuing to hold community outreach and vaccination events. There are numerous sites in Auburn, North and South Seattle, and Shoreline that all welcome drop-ins, meaning no appointment is needed. And you can find information on where vaccine and boosters are available at kingcounty.gov/COVID/vaccines. So with that, I'm ready to welcome your questions.
Thank you so much, Dr. Duchin. And as a reminder to media, if you have a question for Dr. Duchin, please use the raise your hand function in Zoom and we'll call on you. And we'll go ahead with Keith King. Go ahead.
Hi, Dr. Duchin. How are you doing today?
All right, Keith. How are you?
I'm doing well. So we just saw that press release about immunocompromised patients possibly needing a fourth dose or a second booster, if you will. Could you kind of walk through that and maybe also tell us what the timeline would be for that fourth dose for patients like that?
You know, Keith, I knew that this was in the works, but I didn't realize that it came out, and I haven't seen the final language. So I'm going to have to defer on that. I can tell you that, you know, I knew this was being considered at the ACIP level. It was scheduled for release this week, but since I haven't seen the final language, I'm sorry, I can't comment on it.
All right, thank you.
Next question is a question we're hearing from community members. With a lot of folks who've recently recovered from COVID, particularly the Omicron variant, we're hearing questions about whether they should still get a booster shot or get vaccinated, and kind of the timing around that decision for folks who have recently recovered from COVID. If you could speak to that a little bit.
Yeah, great question. You know, the issue of the degree and duration of protection from natural infection versus vaccine protection is really important one. And we've been hampered somewhat by lack of ability to adequately measure the extent and duration of protection in people who have not been vaccinated compared to those who've been vaccinated and who've been in large studies. We do know that based on a recent study from CDC, for example, patients who had natural COVID infection, who are unvaccinated, who had COVID infection, had immunity that was comparable to or better than people who were vaccinated with only 2 doses. That was a study done during the Delta time. And so we really don't know whether that holds with Omicron, which is a much different virus immunologically. But I think it's safe to assume that people who are infected naturally, unfortunately, who are taking a risk of severe illness, hospitalization, death, and long COVID, but who recover, do have some protection. What's not known, and what's still unclear is how do you tell who of all the people who may have been infected develops this protection, because there's no easy laboratory test that can be done to tell. And we know that not everyone develops protection or long-lasting protection, even if you've been infected. So that's a challenge. And we don't know how long that protection lasts or how robust it would be against future variants. Based on laboratory studies, we do know that even if you have been previously infected, being vaccinated boosts your immunity and also provides broader protection against variant viruses. So for this reason, it's a uncontroversial and clear recommendation that everyone, even those who've been infected previously, should be vaccinated.
Great, thank you so much. I've got another question from community members watching on Facebook. They're wondering if you could talk more about the incidence of myocarditis in young men as related to vaccination.
Mm-hmm. Yeah, so for the mRNA vaccines have a tremendous safety record. They've been administered to millions and millions of people and have not caused any serious long-term effects that have been detected, which is outstanding. They have, however, been associated with myocarditis, primarily in younger people, primarily in males, that is of limited duration and much less severe than the type of myocarditis that people get, for example, from virus infections in the community every year. So the cases that have been associated with vaccination typically are shorter in duration and resolve relatively quickly. So it's definitely something that is important to monitor, but in the multiple risk-benefit analyses that have been done, looking at the benefits of vaccination, comparing them to the relatively low risk of myocarditis, considering the fact that COVID-19 itself carries a significant risk of causing severe myocarditis as well as other severe health effects. benefits of the vaccine vastly outweigh the risks in all age groups. And I can tell you that at most ACIP meetings, there's an update, a vaccine safety update. I believe this Friday there's going to be, there is an ACIP meeting scheduled. I believe there will also be another vaccine safety update in which the data on myocarditis cases is updated with the most current numbers. So I encourage you to log on to that. It's a public meeting. You can view the entire meeting or any portion of it that you're interested in on the web.
Great, thank you. Next question is from Jennifer Lee. Jennifer, go ahead.
Hi, thank you so much for giving me an opportunity to ask questions. Dr. Duchin, I have a couple questions, one of them being about the BA.2 variant, which you mentioned. Once we do find more information over the last several weeks about sequencing and data, depending on what that data is, would it be more for public health awareness, or depending on those results, could it also potentially change public safety messaging?
Great question. So BA.2 is, one of the groups of viruses that comprise Omicron, and folks, I think, are pretty familiar with what Omicron's been doing. It's been record-breaking number of cases, hospitalizations, and we're seeing still thousands of deaths every day in the United States due to the Omicron surge. BA.2 is unlikely to change Omicron in a fundamental way. We're in many parts of the country, and here locally in King County, we're probably over the hump of our Omicron surge. And I think it's unlikely that BA.2 is going to lead to another large outbreak. However, what it could do theoretically is, if it starts to take hold, delay the downslope or the resolution of our Omicron outbreak. It could prolong the outbreak to some degree by either being able to reinfect people who've been recently infected with the BA.1 strain, or just seeking out those people who haven't been yet infected, because it's even hard to believe, but even more transmissible than BA.1. So theoretically, it could prolong or maybe cause a bit of an uptick in our downslope, but I think it's unlikely because it's it is relatively closely related, but not identical to BA.1. So it may have some immunoevasive properties, or the ability to get around our immune reaction a little bit differently than BA.1 does. But I don't think it's going to be in a major way. That's my guess. We'll see. It's certainly in other countries where it's been prevalent, and it's very prevalent. It's going to be the predominant variant in several countries around the world shortly, and already is in others. It has not resulted in an increased severity of illness. So, that's really important. It's not going to fundamentally change the severity of infection. And it does seem to be, our vaccines do seem to protect against BA.2 comparable to the way they protect against BA.1. So the vaccinated population, and boosted, I should say, the vaccinated and boosted population among us, which are quite substantial number of people in King County, will be well protected regardless. The group that would be most susceptible, again, are the unvaccinated, which thankfully are a relative minority of people locally. So I don't expect any major, sort of seismic changes in our trajectory of our outbreak, but it could delay things a bit, make things more challenging for the hospitals, who already will be grappling with the repercussions of the Omicron outbreak for weeks after the cases drop to low levels, because people remain hospitalized and the illness takes a while to progress, takes a while to treat. So it could prolong the recovery of the healthcare system, but that remains to be seen. Mm-hmm. Clearly, the best way to protect yourself is, if you haven't gotten boosted yet, great time to get it.
Mm-hmm. And if I could ask one more question, without using the terms, let's say, pandemic and endemic, but I apologize, it's kind of another like crystal ball type question. Just curious to know where you kind of see us going in the next several months ahead. Obviously, a lot of people have kind of tightened restrictions or are following some of the guidance about, testing, rapid testing in advance of events, with the masking. Where do you kind of see us going in the next several months as we enter spring and maybe even summer?
Yeah, if you're able, I'd like to address that after the Q&A and in my closing. I think right now, clearly, we have very high levels of COVID transmission, still at record-breaking levels of COVID out there in the community, record-breaking levels of hospitalizations continuing to occur, relatively high level of deaths for us occurring. And so we really do need to continue to use all of our strategies, our layered precautions, our vaccines, our high quality masks, the importance of improving indoor air quality and ventilation and avoiding crowded indoor spaces and poorly ventilated spaces, now limiting activities to the extent possible. All that's really important right now. As we come out of this surge, things will change, and I will talk a little bit about more about that in a few minutes, if that's okay.
Yeah, of course. Thank you so much for your time.
Thank you.
Great, thank you. Next question is from Como News. Go ahead.
Hi there. You had just touched upon this. You had talked about the peak of the Omicron surge with the new infection.
Como, I'm muting you because we're getting a lot of feedback. If you want to go ahead and type your question into the chat, I can read it aloud to Dr. Duchin.
That was eerie.
Well, while we wait on a typed question from Como, if they're able to share that with us, we're getting another question from community on Facebook, and this, may be similar to what you plan to address in closing remarks, Dr. Duchin, but people are wondering specifically about mask mandates in schools and whether you have any thoughts about benchmarks for changing those mandates or other opinions on mask mandates in schools.
Well, I would just say at this point, I feel that the American Academy for Pediatrics has put out a good statement on the importance of masking in schools with these terribly high levels of transmission that we're currently seeing. We've broken all recent records for hospitalizations in school-age children recently as well. And, COVID is very disruptive in the school setting. So I support the current guidance that we have around masking in schools in Washington State. And I hope that we're able to consider alternatives to that requirement as our transmission rates drop and the risk recedes. And the key things that are going to really determine what the risk to children in schools are the vaccination rates among those children and the people who work in the schools. That will be incredibly important in protecting kids from serious complications from COVID-19. It's not realistic given Omicron, the way this virus has evolved and what our current vaccines are able to do. It's not realistic to think that we're going to prevent all infections in the community or that we're going to ever eliminate this virus, given our current tools. But we can prevent the serious outcomes of these infections. We can keep people out of the hospitals. We can keep people from dying. We can minimize the risk of long COVID. Vaccination is the single most important way to do that with boosters. Boosters should not be seen as optional. They're required for full protection against serious outcomes. The other tools that we have, though, are really important, especially during times when we have high levels of transmission, when risk is high or we are in high-risk environments, crowded, poorly ventilated spaces, et cetera. And those tools are improving indoor air and ventilation and using high-quality face masks. So when we're at a high levels of disease transmission, risk is relatively high in the community, using all the tools available makes a lot of sense. As the risk levels come down, we should be able to scale back the types of things that we do, and let people have the option of whether they want to take enhanced precautions to protect themselves or those around them.
Excellent, thank you. All right, we've got a written question from Como. Thanks for working with us there, Como folks. It's a three-part question, some of which you've already touched on. So part one, how much closer are we to the end of the pandemic and families and businesses getting back to normal? Part two, how much do people need to worry about breakthroughs? And then part three, any comments you want to make about children under 5 potentially being eligible for vaccination soon?
Okay, so I'll go with part one. I'll address in a few minutes about where we're headed. Part two, breakthroughs, how worried should people be? If you're vaccinated and boosted, you shouldn't be very worried about a breakthrough. You should be worried if you're in contact with someone else who's unvaccinated, unboosted, or is highly vulnerable, and you should take precautions even if you're vaccinated and boosted, knowing that you can become infected, even though you yourself may not get seriously ill, and you may not even have symptoms at all. You can still shed the virus. Now, we do know that people who are vaccinated and boosted are less likely to transmit the virus to others, but it can still happen. So vaccination plus boosting should provide a lot of confidence that someone is not going to have a serious outcome from COVID-19, and people should feel well protected. Unvaccinated or vaccinated and unboosted are at higher risk, particularly the unvaccinated. And they are at high risk for serious outcomes, including hospitalization, death, and at higher risk for long COVID, also at higher risk to spread to others. But the bottom line is vaccinated and boosted should feel comfortable, but also be aware that they can get a mild infection that can spread to others. So if they're around vulnerable people, they should still consider what precautions might be needed. Children under 5. So this is a work in progress, and things are happening now. There's a meeting of the FDA's advisory committee next week to evaluate some data from Pfizer on 2 doses out of the 3-dose series that they're testing to potentially authorize folks to start vaccinating children between 6 months and 5 years of age. Pending the results of that discussion at FDA, the ACIP will meet shortly thereafter and provide guidance to healthcare providers. What we're doing locally is we're anticipating that a vaccine will become available for children between 6 months and 5 years of age by the end of March. Could be as soon as mid-February, but it's hard to predict with certainty because it all depends on the outcome of these upcoming meetings, which haven't happened yet. But we think it's going to happen. Best guess is there'll be a vaccine available within the next month for this age group. And we're working hard to identify healthcare providers throughout the community that can provide vaccines to these children and their families.
Thank you. All right, last question, and this is a question from community member on Facebook. Dr. Duchin, you've talked a lot throughout the pandemic about the importance of indoor ventilation. And folks on Facebook are wondering if you can speak more about what ventilation measures are being encouraged locally and nationally.
Well, yeah, it's different answer depending on what type of facility or environment you're talking about. So for households, right now, when COVID's prevalent or when someone has COVID in the home, it can be as simple as opening windows, cracking windows, even just a little bit, turning on ventilation fans over stoves or in restrooms, and improving, having your home air handling system, your heating, cooling system looked at to see if you can put a higher level of filter in there that can filter the virus. Many can't take that in home environments, but it's worth checking out when you have your system serviced. MERV 13 is really what is recommended, and that puts some stress on the system. That's really sometimes not a good idea for household air handling systems. But for buildings, it's different. They can upgrade the filters, they can bring in more fresh air, through their systems. And in some settings, actually households can do this as well, add portable HEPA filters, which can cycle the air through and remove viruses that might be circulating. We can also monitor indoor air quality using portable CO2 monitors, carbon dioxide monitors, which give an indirect measure of how well ventilated spaces are. And these are really handy. You can find these portable monitors. They're small, online. I personally own one called the Aranet 4, ARANET 4, all one word. You can take a look at that and just get some idea of what this technology is. They're not terribly expensive. They're I think really useful way to know if ventilation improvements are needed in a space. They're not perfect. They have some limitations, and you can read about that actually on our website. We've got a really good site on improving air quality in buildings. Maybe Kate, you could put that up if possible, which talks about the different strategies that can be used in different environments. And finally, UV technology, not for households, but for large spaces, buildings, is another option when ventilation and filtration aren't adequate.
Wonderful, thank you so much. And yeah, we'll share that. We're sharing that blog right now with other tips and tricks for improving indoor air ventilation. So with that, Dr. Duchin, I'll hand it to you for any final remarks.
Okay, thanks. Well, I'd like to thank everyone for joining today, and for folks who anticipated what else we needed to talk about, which I hope to address right now. We are absolutely in a better place today than we were a year ago, and things are absolutely continuing to improve. Our vaccines and boosters are preventing serious illness for most King County residents. We have more treatments and more tests coming online. There's a better understanding of the importance of airborne transmission and how to prevent it through improving indoor air quality and for using high quality and well-fitting masks. We are making meaningful progress. At the same time, we need to be realistic about where we are on this long and winding road to the post-pandemic state. With thousands of people still infected every day in King County and hundreds hospitalized each week, COVID-19 is clearly not over, but we are heading in the right direction. So for now and for the coming weeks, this means keep doing what works. Get vaccinated and boosted. Improve indoor air quality. Use high quality face masks and respirators in public spaces. Limit gatherings in crowded and poorly ventilated indoor spaces. And isolate and test if possible when you have symptoms. Looking ahead, it's reasonable to expect high levels of vaccination with boosters, plus recent post-infection immunity in the population, could protect against another major surge coming soon. And we don't know how long immunity from Omicron infection will last, or how well it or current vaccines will protect from future variants. So that limits what we can say with certainty. But over time, population immunity from vaccination plus natural infection should lessen the impact of COVID-19 significantly. Increasing access to improved treatments will also help a lot. If we're lucky, the virus won't deal us a new, highly transmissible, severe, immunity-invading variant. But there's no guarantee that future variants will be mild. So for this reason, we need to build COVID resilience and better future preparedness for COVID-19. The long-term trajectory of the COVID-19 pandemic will bend towards something we can manage successfully as part of our routine lives. But exactly how long it takes to get there and what unanticipated bumps in the road might lie ahead remain uncertain. I hope the next time we meet, with additional progress and experience, we can give a little bit more certainty to these forecasts. For now, I hope you all stay well and look forward to talking with you next time.
Thank you so much, Dr. Duchin, and thank you to the media who joined us and everyone who's watching live on Facebook. As a reminder, you can follow along with our work at publichealthinsider.com and follow us on social media at KC Pub Health. Thanks so much. Take care.